Hello, everybody. Thank you so much for joining us today. We're so excited. We have Dean Wettel with us today. I'm going to be doing a quick introduction for Dean Fox. Fun fact, when I was a student in the program 10 years ago, she was my professor. She was the dean at the time. She was my professor. She taught the qualitative research methods course for me. And I'll never forget this assignment that she made us do where we had to pretend like we were aliens in order to go out there and think about the world without any biases. So we had to go out there and look at the world with fresh eyes. And then it really, really underscored to me how we bring so many biases from all of this stuff that we already think we know about the world. And it was one of the best assignments I've ever done. I remember I had to do a little drawing as well of what I saw in the park. And it was such a great way to learn about bias. So yeah, she was a wonderful faculty to have. She was so engaging. I loved her course. I would recommend it to everybody. And I'm so thrilled that we get to have her with us today. She was the inaugural dean of Brown School of Public Health, and she's currently a professor emerita of health services policy and practice. Before joining Brown, she served as the deputy director of the NIH Institute on Aging and held leadership and faculty positions at Yale, Harvard, and the University of Connecticut. Beyond academia, Dean Fox has worked in government. She served as a social policy analyst and the director of an area agency on aging. She's the past president of both the American Federation for Aging Research and the Gerontological Society of America, and has contributed extensively to public health through over 200 publications. I still remember Dean Fox had done research on marijuana before it was cool, and she brings so much wonderful perspective and leadership insights that it's going to be a treat to watch today's conversation. So we're so happy to have you here with us, Dean Fox. So thank you so much for taking the time to be with us.
Thank you for inviting me.
Of course. All right, now I'm going to turn to our student moderators to introduce themselves. First, how about Valeria? Still muted.
Stay muted.
There we go. Yeah.
There we go. Hi. I a student in the online program from Public Health. Such an honor to be here and participate. One of my questions is in career and professional growth. One thing that I noticed as I read in your biography and everything was that you have different job opportunities. So my question is that, do you believe that your success and strong professional backgrounds are in part the result of your choices to explore different job opportunities? How do you think this approach have shaped your career growth and professional development over time?
Well, the answer is yes, but I'll say a little more, which is that my PhD program was a multidisciplinary program, and I very much enjoyed learning about different disciplines and also working with the students who were from other career paths. My science has always been team science. I've always worked with a group of researchers to address the questions that are important. And I also made it kind of a practice or a strategy to try when opportunities arose, to give them a try. So working in government, working in academia, back to government, I felt that those broad array of experiences really, really helped me to understand the broad array of public health practice and policy and research. And so I recommend to MPH students that they also seek broad opportunities when they have a volunteer opportunity or a work opportunity that's a little outside their comfort zone, to give it a try.
Thanks, Val, for that first question. Did you want to go ahead and start the second question?
Valeria, you're still muted.
Okay, sorry, it just keep unmuted. So my second question is, your career has been expanded multiple arenas of public health, from research to for research to policy to leadership. How have these diverse experience informed your approach to mentorship and shape the quality and thrive in yourself and look for others?
Yeah, and because public health embraces such a broad array from basic science all the way to policy to ethics, philosophy, I think that the broader your experience, the better it is that you can do your job well, that you can do your research effectively. And so, from the beginning in my own career, after I finished my PhD, I had this opportunity to go to the East Coast. I grew up in Oregon, to go all the way to the East Coast by myself to take a job all by myself. And I was young and scared. I had a little kitten in a little box under the seat of my plane. And my little kitten and I arrived in Washington, and it was opening a whole new door for me. As I said, I like to stretch myself to say, well, I've never done this before. Let me give it a try. I worked very, very, very hard. And I learned a whole array of new things. From there, I had an academic opportunity. I mean, at the end of that year for that job, I could have stayed, but I said, I want to try something new. And so I interviewed all over for jobs, and the one at Yale was the best fit. I took that job. I did it for 2 years, loved it, but my research was more and more in ethics and policy, and I wanted to learn more, so I applied for a fellowship at Harvard and got it, and then stayed there to work more as a faculty member. So at each step of my career, it was almost when I came to a fork in the road, I would take the thing that was more challenging, that was harder, that was more of a stretch. And because of that, I began piling on more and more new experiences. The other thing I will say is that I did a lot of volunteer work over the years because it allowed me to learn a new skill set or work with a different population. I've always done aging, and so I volunteered to cuddle babies at the hospital. It was just my way of stretching what I did.
Thank you, Fox. Valeria, did you have another question, or are we turning to somebody else?
Okay, sorry. I think Jessica will continue now.
Yes.
Okay, Jessica, before you dive into your question, could you quickly introduce yourself as well, please?
Yeah, of course.
Thank
Hi,
you.
everyone. My name is Jessica, and I'm a second-year student from last year's spring cohort. I'm based in New York City, and I currently work as an analyst for a health insurance company. I primarily support patient safety projects. I have a strong interest in health equity and social determinants of health, and I'm really excited to hear from you, Dean Fox, about your background in aging research and policy. So I do have one question around this. So your leadership emphasized translating research into actionable policy. Can you share an example where academic research under your leadership directly influenced public health policy or programs?
Yes, I'll give an example a little further back, which is when I was still in Boston at Harvard, I led a team of people who were interested in the perceptions and preferences of patients regarding end-of-life care. And so we interviewed patients at many, many nursing homes, and then we also interviewed physicians and nurses and social workers who were practicing in hospitals to see what their thoughts were about patients being involved in care decisions in end-of-life care. And there are several papers that came out of that work influenced not only practice at the Veterans Hospital Veterans Administration, but also was used to inform the Patient Self-Determination Act, which now provides guidance to end-of-life documentations, advanced directives, preference in care conversations. And so it was very exciting both to see that our work could help with many other studies, could help influence policy, but to see over time how those policies got implemented, it was very exciting.
Okay.
Who's next?
Sorry, I was having trouble with the unmuting. So thank you for that. So what skills are most valuable for public health professionals working on aging and long-term care policies?
Well, I believe that there are many skills that are valuable for all people working in public health, but particularly for aging. One is to have understanding and respect for the population, and for vulnerable populations in general. And I think that part of that comes from listening to those populations, to reading research that gives voice to those populations. So I think that that's one important thing. Another, if we're thinking of the long-term care population, is to really understand the rules and regulations and policies coming out of Medicare and Medicaid and state organizations, because I think that that helps us inform how we can be better advocates, how we can be better researchers. I think that, and I give this advice to all people, to be able to ask a good question, or to say, what is it that I am really focused on? And by being very clear in that statement, you can communicate well with people, both with people who are delivering services or making policy, but also in your own research activities.
Thank you, Dean Fox. Those are all my questions around your work with research and policy. I appreciate
Thank you,
that.
Jessica. I think we're up with Samantha.
Yes. Next up, we have Samantha. Samantha, please introduce yourself and then you can ask your questions. Thank you.
Okay, so my name is Samantha. I am in the online MPH program. I'm technically in year 2, but have been on a bit of a modified schedule, so I'll finish eventually. I work as a pediatric nurse, primarily in pediatric hematology and oncology, but really done the gamut. I've worked travel nursing and all that. So my different experiences through medical care, especially with kids who are also a vulnerable population, has really reignited my fire for public health, specifically in area with like specific attention to non-English speaking patients and limited English proficiency patients. I'm originally from the state of New Mexico, where there's a lot of non-English speaking, particularly Spanish speaking. So that's been a big focus of mine, similar to kind of Jessica saying, the social determinants of health and equity in healthcare. So the questions that I have are focused a little bit more on your mentorship. So over your time working in public health, you've mentored hundreds of other public health professionals across various disciplines. I know we talked a little bit about what you think are positive skills for individuals themselves, but what qualities do you believe are essential for effective mentorship, especially when mentoring emerging leaders?
It's a great question, and I think the most satisfying aspects of my work have been in mentoring, so I love talking about it. The first of all, I think that mentoring is a partnership between the mentee and the mentor. And I think that in order for that partnership to be healthy and functional, there has to be a good agreement. And that agreement is for what are the rules of the road for this relationship? You know, is this going to be a meeting every now and then, or a regular once a week? Will there be deliverables for the meeting? What are the goals of the mentee out of this relationship? What are the goals of the mentor? And having that agreement, I think, is very helpful. When I meet a new potential mentee, and I still meet new ones, if anyone online wants to have a mentor, I'm always available to talk. But one is to say, well, understand your aims and goals so that maybe I'm not the best person to be the mentor. Maybe I can help you find a better mentor for what it is that you need. The other thing I'll say is that my mentorships tend to be very long. I am actually still in a mentor-mentee relationship that goes back and forth with my statistics professor from graduate school. I love her. She taught me how to write letters of recommendation and how to give talks better. She's just a wonderful person. And I have mentees in mine for more than 40 years, where I have one who's coming for lunch in 2 weeks. So some of those relationships last a very long time, and the lines begin to blur between mentor and mentee. Some of them have been very short. I've been a mentor to someone who was applying for law school and just wanted to have advice on how to write a personal statement, where to apply, how to do that. And once they got into law school, they said, I got in, thank you. And I think I get a Christmas card every now and then. So the relationships can be very different, but I think it begins with that true understanding of what each of you expects. I think that developing trust is important, understanding what will be shared or not. I always ask permission before I share any information with someone else. That's me, but there are, different circumstances. Someone is having trouble with another professor. I might give advice. I might say, would you like me to talk with them? And it's always based on the mentee's choice. I think the final couple of things is that from a mentee's perspective, I always want them to give me feedback. If they're saying, I don't think this is going well, I want someone else, I will take that personally for about 2 minutes and then help them find someone else. I want feedback. Did you apply for graduate school and not get in? I want to know. I want to know the good news and the bad news. Did you apply for the grant? Didn't get it? Let me the job, whatever. The other thing is, I will say gratitude. A simple thank you goes a long way. I don't expect to be heaped with gratitude every meeting, but now and then it's nice to hear. And I like to say thank you to my mentees because I learned so much from them. So if you are thinking about seeking a mentor, I would suggest thinking a little bit about what you want from that person. I have multiple mentors and always have in my life. Do I want someone to give me help on writing an application? Do I want someone to give me advice on how to negotiate academic politics? Do I want someone for advice about my work with my patients? I'm having trouble communicating with this parent. How might I do it? So knowing what you want from that person and being very clear. The relationship may change over time. I've had mentees who become like adopted daughters, but in the beginning, it's really nice to know what you want and what you expect.
I think that those are like very good things to kind of bring up and think about. I guess something that came to mind while you were discussing that is you're talking about having to be very specific and wanting to know exactly what you want out of your mentor. And I'm thinking of my own personal experience, and I have not, I don't know that in my burgeoning public health career, I'm quite there yet. So what advice do you have for kind of getting to that place?
Right.
Yeah.
Well, it may be that your ideas are sort of inchoate and you're not quite sure. And it may be that you just want to talk with someone to say, I'm thinking about getting a mentor. What are some of the roles that they may plate for me, and how might I think about that, and who might be the best person? I mean, I was in a formal mentoring program for Brown University where they deliberately had me be a mentor to someone who wasn't even in the School of Public Health, because that person, what they wanted was advice on how to negotiate politics within the department. And it was easier for me not being in the department, not even being attached, so that I could help think that through without, that she could trust more that I wasn't going to get involved, but that I could also trust I wasn't going to give her, you know, scary advice. So part of it is thinking about, asking about, and as I said, mentoring for different things. I mean, it may be as simple as, you know, I'm not quite sure about what courses I want to take next. I know there were advisors, but I really want to move in this way. How might I think about that? Or I'm thinking about a thesis topic, project topic. I don't know quite what you want to talk about that. All of those things have been involved. And a good mentor will say, well, I'm comfortable talking about this, but work-family balance has nothing to do with me. So maybe someone else would be good. It's just figuring that out.
Okay, so I have a few more questions if you don't mind. So the Terry Fox Weddle, yes,
Yeah.
Rising Star Award was established in your honor, which was, as a way to highlight your impact on young researchers. What advice do you give to early career professionals aiming to make a meaningful difference in public health? And this is like very personal to me because I feel like working in healthcare, I want tangible things. And so that's been a motivation of public health, but also frustration recently and with how things are currently going in our healthcare system.
Yeah, it's a hard time for me too. Well, to young professionals, one of the things that there are a few things. One is I really encourage people to think about, what is it that I do well? What is it that I really enjoy doing? And what are the things that I would like to learn to do better? And having a good sense, maybe you're a really good manager and administrative things are really good and easy for you. And what you need or would like to know more about are quantitative skills, or you'd like to know more about policy. And having a good understanding, being both honest with yourself and asking for feedback about your skills and areas where you could work harder or need improvement is very helpful, because it helps you choose. It helps you to choose volunteer experience. It helps you to choose a club you might join. It helps you choose a course you might take. And that, I've made decisions for jobs based on both. Well, I knew I could do this part, but I really wanted to learn how to do this part. And that has worked very well for me. Other things is within my realm of work, doing volunteering for a committee has helped me either learn about the institution or learn about the budgeting process or learn. Those were all experiences that helped me along the way. In the beginning, I didn't have a lot of skill around financial management. I just had never taken a course or whatever. And I volunteered to be the treasurer of my condominium association. And then when I got to NIH, it turned out that at my level of administration, you could take courses, weekend courses or week-long courses or whatever. And I took every one I could on financial management and personnel issues, because I knew that was something that I wanted to develop more skill in. I didn't know, well, at that time, I didn't know I was going to be a dean. It sure helped me be a dean in the long run, but that has always, I've always had this desire to kind of learn more. And quite frankly, it's why MPH programs are so attractive, I think, is because you get to learn more in several aspects. You know, you learn epidemiology, you learn quantitative skills, you learn health services. I mean, for me, it was kind of heaven to learn all that. So for a young person, getting back to your question, for a young person, it's doing a very careful self-evaluation or asking others to help evaluate you, you know, the 360 thing where you ask a bunch of people to evaluate you and listen to what you hear. But also to find opportunities to expand yourself, take risks, you know, volunteer for something within your insurance company that may, you know, there may be a committee, there may be a project, you know, where you have an opportunity to learn. I think that that's all. And it all, if you're strategic, it all goes on your CV. It all goes on your resume. You know, for a long time, I had treasurer of my condominium association on my CV because it was a demonstration of being able to do something that otherwise wouldn't be obvious.
That's really good to hear. I've always worked with kids and I did a lot of volunteering with a nonprofit dance organization for kids. So it's a lot of times I don't feel like that's directly translatable except for my personal interactions with kids, but you know, that's management of 500 kids
It
under
sure
10.
is.
And so that's good to know that, you know, all experience is something that can be contributed to other experiences.
Mhm.
And I very much agree with what you said about the MPH program. I think that was part of what pushed me to go in that direction with my
Mhm.
health career because I kind of settled into the health aspects, but I wanted to know how to make more effective change. And I think that's exactly what this program has been teaching me, hopefully, as I finish up and try and take that into the professional world.
Mhm.
I just have one more question, then I'll turn it back over to one of my other people. But so you have held leadership positions in organizations like the American Federation for Aging Research and the Gerontological Society of America. What role do you feel like these professional societies play in shaping careers of public health professionals, or do they?
They do. And it may not, I mean, for you, it obviously is in the Gerontological Society, but maybe something in APHA. And for each of you, it may be a different organization. I highly recommend becoming involved. And there are student parts of each of these organizations, and then there are professional development parts and whatever. And I think there are several reasons, and I'm going to sound overly planful and perhaps strategic, but this is true. First of all, you will have opportunities to learn more skills because you'll be on a committee, you know, you'll be on I've been on the awards committee, I've been on the selection committee for grants, I've been on, and each time you learn about process and how to write a better grant and how to write a better statement. Another thing that happens is that you become more known beyond your own little puddle. You begin known nationally, whatever. And I'll give an example that I did not plan, but happened. I was very active in the Gerontological Society. I was working in Connecticut where I was building my own research center. I get a call out of the blue from a man who had been the former president of the Gerontological Society, who's Paul Kirshner, and he said, "Fox, why haven't you applied to be deputy director of NIA?" And I said, "Because I'm not qualified to be director." He said, "I think you are, and I think you should apply and do it right now." And so it was a Hail Mary, what the hell, you know, I guess it's a mixed metaphor, but I said, sure. I sent in my CV. You had to fill out this 191 form that went on forever, but I sent it in. Didn't hear anything for a while. Then I get a call saying, "Would you be willing to come for an interview?" Well, it turns out that Paul, who had been president of GSA, where I had done presentations, whatever, he knew me, was the head of the search committee. And I came in, I interviewed, again, thinking I had no chance in hell. I was actually a little bit relaxed because I didn't think I had a chance. And the next thing I knew, I got offered the job. And had I not been involved in GSA on various committees and doing various things, he never would have thought of me. It was not like I was the obvious choice. He never would have called, and my life changed. I mean, it was an amazing 6 years of experience. So that's just one little example, and I have 15 others from my life where doing volunteer at one place made me get asked to do something else, or it was a job offer, or it just is. These networks are very important, and you never know how they're going to come together. And so that's one thing. Also, if you're taking a more academic career, getting outside awards is very valuable. Not for, I mean, they don't have money, but because it's a form of recognition. And I would say that promotion, when people are considering promotions, that sort of external validation can be very important.
I don't want to hog all the time, but I guess just taking that from my perspective, I am not currently and don't necessarily plan to be working straight in the public health field. I want to incorporate that into my nursing practice. And in my experience, I don't know, you create these relationships with patients and things, but there's not always a direct reward system for that. So are there, other ways to try and, like, I have a lot of certifications and I think I do a good job, but it's not the same type of award thing in like a traditional like corporate structure or something like that. So I wonder if you have any thoughts on that.
Yeah, I do, because I have worked in organizations that had different, like in federal government, a very different evaluation and promotion system. So what I would say is that, and again, it depends on your goal, your personal goal, career goal. What is it that you want? So if you were thinking, I would like to do higher levels of administration, then the network within the hospital system, within the hospital systems across the state, being involved in that network, having people know you, makes it more likely when those opportunities come, you might be considered. So that's one way. The other is, and this is, I mean, working with little kids, it's unlikely they're going to help your career right away, but they do have parents, and the parents know and have, and it's amazing to me how many times someone will say, well, you don't know me, but you taught my son in such and such a course, and it made whatever difference. And that can make a difference too. The network, and it can do it. I'm talking about the positive way, but we all know the negative way, where it only takes a couple Debbie Downers and you begin to develop a reputation. So it's positive. I'm going to interrupt because I've been thinking about a question that Jessica asked me. I'm going to go back to it because I'm not sure that I completely thought about it. And this is translation of policy and practice. I'm sorry. I hope I didn't cut you off, Samantha. Okay. I wanted to say something else about translation, and I hope I'm not repeating myself. One of the issues that has always struck me that's very important in translating policy and practice is that policymakers and researchers or public health workers have both different timelines and different vocabularies. And I'm just going to make a comment about that. Often I would get a call, I was going to say from a congressman, never from a congressman. I get it from one of their staffers, to be honest, one of their 14-year-old staffers. But I would get the call and they would say, you do research in this area. Tell me, what do you think about X or Y? And I would have my research answer and I would be thinking about it. And I'd say, well, I could get back to you in a few months. No, we need it today. And the truth is, when a policymaker has a question, they're asking for it for today or tomorrow. They don't want your 5-year research timeline. And it means that there are always there's a little bit of disjunction there between you. The other is the language you use. Policymakers often want very definitive, very short statements about, okay, if you increase the staffing in the nursing home, these are 3 outcomes that will occur. Or if the reimbursement rate for geriatricians, we don't often think that way as researchers, and we have to learn, I think, to be able to translate into the language of policymakers to be effective. And that's always a challenge. And I think that we don't often do our students a service in helping people to think, okay, how do I talk to this person who's in policy? The other thing, and I'm a qualitative researcher, you heard that earlier, that I used to teach qualitative methods. And one of the reasons I love qualitative research is that we hear the perspectives of our respondents in their own words. And I think that's very powerful. But it's also a very, very powerful tool when we're talking to policymakers, lawmakers, in our state or in our federal programs, that the words of the people who are being impacted carry power. Medicare only pays for one chronic disease under the age of 65 or whenever you join Medicare. That chronic disease is end-stage renal failure. Now, why is that? Any of you know? It's because a man who was on dialysis got wheeled into Congress and testified to the committee about what his experience was living, getting dialysis. He was getting it 4 times a week and trying to work and the expense of it and whatever. And Congress passed paying for, it's amazing to me. But that is, you know, I was once on the Hill to testify, and the next person up was Michael J. Fox talking about his Parkinson's disease. Well, the interest in me was about this compared to the interest in him. So figuring out how, when we want to affect policy, figuring out how to give voice to the people those policies are going to impact is another really powerful and effective thing to do. And sometimes it takes some creativity to get there, but it's why I've always done either qualitative or mixed methods research, because even if I had great numbers, I always wanted to have quotations from the people who were involved.
I'm just going to give a little shout out to Professor Harvey, because he, like, in the first policy class that I took, he did a very good job of actually trying to prepare us as that we need to put these in words that somebody can read and process and make a decision on. So I think the program is doing a good job at that. I don't know if you guys agree with
wonderful.
me.
I'm happy to hear. You know, it's funny because I used to say, when you're going to go to a meeting, a professional meeting, you should always have what's called an elevator speech. I don't like that phrase, but you should, if someone says, what is it that you do, or what is your research, or what is your career goal, you should have a very clear one-sentence statement. And if they say, tell me more, you should be ready to expand that into a good paragraph. And that one-sentence statement, my Aunt Jane at Thanksgiving dinner, who's a hairdresser, should be able to understand what I'm saying. And if I can't make her understand it, then I'm in big trouble elsewhere. The other thing, it's about professional meetings and how important they are. We were talking about being in professional organizations, but also going to the meetings. When I go to a meeting, I have a list of people that I want to meet. And I want to meet them because I know their research, I know the work they do, I think it's good connection for me, or I have a question about their research. And I either email them ahead, or if I see them, say, do you have time for coffee? I want to ask, or I have a question. And it's really important to be prepared for that. The other thing is that if you're sitting and you're listening to people making a presentation, listen, and if there's a question you want to ask, you don't always have to raise your hand. You can go up at the end of the lecture. There's always people standing there, wait your turn, and say, I found this so interesting. I do pediatric work. I do long-term care work. And I saw how this would apply. How would you, whatever your question is. And now and then they'll be rude and say next. But usually it hits their ego that you care enough about their work to tie it to yours to have a good question. And this isn't why you do it, but I actually met my husband by standing in line, waiting. He'd given a talk on treatable dementia. And at the end, I said, I have a question. I asked and he politely answered it. And that was how we met. We didn't start dating until months and months later. It wasn't like that was my pickup line, but it is so important to, going to a professional meeting is an amazing opportunity, and being prepared to use it well is really, it's an important thing to do.
Dean Fox.
Yes.
I work in long-term care. I work for a nursing home that they have 200 nursing homes all over the country, and all your research and all your policies, it really have influenced how we work. And one of the funny part is that in 2017, I took a job in a nursing home as a respiratory therapist because we were trying to avoid bounce back to the hospital. Mm-hmm. So it's kind of interesting to see that all your hard work have got me a job. But but I will ask you one more question here, sure. And this one is in leadership and philosophy. Leadership philosophy. You have described public health leadership as a blend of missions and partnership. How do you cultivate collaboration across discipline, maintaining a strong leadership voice?
That is a great question. And I have to say, it was one of my larger challenges in building a school of public health at Brown. When I started, there was one department, and then we grew. And I had statisticians who didn't talk to epidemiologists who didn't, and it required both formal and informal strategies. First of all, on the more formal side, I just said, I made a statement that we value talking with one another. We value interdisciplinary work. We value getting together work. But informally, it was, making talks where we had two presenters that were from different, so that people from both sides came, or having a social event having coffee where we talk. And it was making courses where they were jointly taught. It was, you make the statement and then you figure out a way to walk the talk. And it was sometimes successful, sometimes not so much, but it was, and in a way, it was a bit easier in public health because public health is so multidisciplinary. But it still has its little silos. And it was, when the school was smaller, we were all on a couple of floors. Now, departments have their own floors. And I got in the elevator the other day, and I used to have my office on the 7th floor, kind of near the statisticians. Now it's on the 6th floor, near the health services people. And one of the statisticians said, "Fox, I haven't seen you. I never see you. You're not on my floor." And I realized that we have to figure out ways to get people to mix. The other thing is, I faced when I was doing work in hospitals, I faced that challenge too, because there were hierarchies. No surprise, the physicians, the nurses, and getting people to talk to me for my research was sometimes hard. If the physicians were in the room, sometimes the nursing staff wouldn't talk because, whatever. And figuring out strategies to either interview them separately or figure out ways. I'll give you one little example that worked, which is in our geriatric rounds, where we had nurse, physician, social worker, me as the ethicist. When I started, it was always the physician who did this. 92-year-old patient presented with blah, 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 blah. And listening to that for a few months, I said, I'd like to start this differently. I'd like for each case presentation for us to rotate. For one, the social worker does it first. For one, the nurse does it first. For one, and it was fascinating. Two things happened. One is the doctors learned things that they had no idea about the patient. I mean, the social worker in the family setting and the nursing, this person's having trouble ambulating, whatever. But the other thing that happened is that over time, there was a new respect for the content that person had, that each of the professions had. And I love that. And it was just a little tweaking, if you will, of the presentation. It's like in nursing homes where you have the case conference and the family members may be there or not. And I so often sat in on those and saw people like the respiratory therapist, if they were there, never being asked or never having a say. And I think that there are ways the dynamic of the meeting as a part of the leadership can make that happen. And I love when those little strategies change.
I would say that I'm very fortunate to be able to participate continuously in the delivery of care in the team. Respiratory therapy is kind of in a gray area. We are not a nurse and we are not a doctor, but we do have a lot of education. But we also see the patient as a whole. So I do think that those care team meetings make a big difference, and the nursing homes are the way that we prevent these patients to going back to the hospital, the way that we have the time to educate them and train and differently that we can do in the hospital, because in the hospital we only see the acute disease. We don't even see the patient as a whole. We just treat the COPD exacerbation, and that's all what we treat. When in the nursing home, we treat every step on the patient. But thank you very much. I think Jessica is next.
Thank you, Valeria. I do have one question around your global experiences. So How have they influenced your leadership style and approach to public health challenges?
I didn't hear the first part, I'm sorry.
How have global experiences
Oh.
influenced your leadership style?
Right. Well, I've had the good fortune of doing work early in my career in Southeast Asia and then more recently in Italy, primarily, but have worked internationally. I think that it was helpful for me first to see it's very hard to understand what the water is when you're swimming in it. You know, if you're a fish in the fishbowl, you never know what another water is like. And when you go to another country to work with colleagues, the differences are sometimes profound and sometimes not so obvious, but have a profound influence. And so working in other circumstances has helped me to understand different leadership styles, different interaction styles, different ways of working that may be effective. It's also been very helpful to me with my international students to understand that the world that people are coming from may be very different than the world here, and giving me some insight into helping translate those worlds can be useful. I'll give you one example that seems silly, but when I went to Italy to work, I thought, boy, these Italians don't work very hard. You know, they come in, they have a 2-hour lunch, often with a little wine, and then they have a 2-hour dinner. What is this? And I was thinking of the workspace and how people worked defined by when you were at your desk. And what I discovered participating in those 2-hour lunches is that a lot of work got done there. I mean, a lot of discussion of academic policy, of coursework, of research, and that the dividing line between work and lunch was not so severe. And that was really helpful to me. The example that I think in Southeast Asia came much earlier in my career, and I'm telling a story on myself about my own narrow cultural view, which was I had been doing this research on patient self-determination and my view was that patients should be involved in every decision, that they should have a voice, that they should. And I began doing interviews. And I remember I was in Singapore and I was interviewing this man in health. He had a high position in government. And I said, well, tell me about involvement of patients in end-of-life decision-making. And he looked at me as if I had 3 heads. And he said, we never involve an older person in that. He said, it's the family decision and it would make them feel terrible to talk about those decisions. And it hit me like a rock in the head. I should have known, because when I was young, my mother worked on the Navajo and Hopi reservations in Arizona. And among Navajo, it's considered the worst faux pas to say, well, grandpa has cancer, to him, to say, well, grandpa, you have cancer. That talking, and this may no longer be the case, this wasn't, but it was rude. It was beyond rude. It was like bringing death into the room. And so understanding those cultural differences, both in leadership, but in view of the world, helps you to expand. And the thought that not everything we do is the best way to do it, which many Americans have that sense that, well, we do it, it's got to be best. Well, no, there are other better ways to do some things, and we should learn how.
Thank you for
This
sharing.
has been so much fun. I love this. I wish we were in person.
Thank you for sharing your experience. I think Samantha has one more question to wrap up the discussion here.
Yeah, so I had watched, I think it was a video that you had done for Brown, about talking a little bit about like the creative methods. I think you had taken some of your public health students to like this comedy show. And I just wanted to get a little bit more of like how you feel like that has been a positive or negative, I feel like positive, like method to getting people interested and motivated about public health issues.
One of the plays, if I remember, that I was talking about was it was a play, the title was There But for the Grace, and it was about food programs and kitchens, community kitchens or community pantries to feed people. And the play was it was a one-man show, but he acted different. He interviewed different people from the food pantries. And I loved, and I've also taken them to comedy, but I love expanding our view of how we think about public health. And Nita will know this because in her course, I had them read a science fiction book, right? And the reason I did it was it taught about how to observe differently. If you are on another planet, you have to really think about your biases and set them aside. And I think that the arts can help us really think about the work we do and the populations that we work with kind of a new eye, a different perspective. And I'm always trying with myself and with others to sort of expand the perspective to say, you know, there are other ways of thinking about this. And the more that we can put ourselves into this other person's shoes, the more likely we are to be more compassionate, more understanding, more effective. And that's why I had students read science fiction or poetry or go to plays, because it just gets us expanded a bit. You know, I'm always boundary pushing, always, you know, how can we take a step further to do this better? And how can we take a step further to better understand? And how can we take a step further to bring us all together to do things better? And so that's that was my philosophy for that.
Thank you so much, Fox. This has been so delightful. Like, I don't know if you could see my video, but I was like actively nodding to everything you were saying because it was so engaging. I loved hearing everything you were saying. And you're so right. I still remember from that assignment, I think I had said that cats are the dominant species on Earth because from my observation as an alien, it looked like humans were catering to everything a cat wanted. So it was so fun to sort of suspend my beliefs and like think about only what I was observing and like making assumptions based on just what I'm observing. It may not be right, but it's what you observe from the data, which is mostly what we do with qualitative analysis. So I still remember your course being incredible. I learned so much from that. And you've always been sort of pushing the boundary on that, even in terms of mentorship. I learned a lot about being a good mentor just from watching you. I remember, you know, you were the dean and you were faculty, and I wasn't sure if I can approach you for a letter of recommendation. And you were so kind. You were like, yeah, of course, I'm happy to help, but tell me more about you, tell me your goals. And you really took the time to discuss my goals with me and then help me. And, you know, we stayed in touch after that. And when I came to Brown and started working at Brown again, you know, you were one of the first people I thought of as well. So it's really incredible to see how much you do for the people around you and the sort of culture that you created at Brown that, you know, I still strive to implement even within our team right now. So it's been wonderful having you talk to us today. I know we could keep chatting for hours. Just last month, I think when I was with you, I stopped by for like a 5-minute conversation and ended up staying for almost an hour. So I can keep chatting, but it's been amazing hearing everything and still learning from you about what it is to be a good mentor, how to be a good mentee. And And I'm sure our students took some really good advice from you today. So thank you so much. We've recorded this, so we will be sharing this with others who couldn't attend today. But thank you so much for taking the time.
You're welcome, and I am always happy to talk with anyone, anytime. I enjoy, one of the things I should have said is choose work that you love, because it's never really work. It's just doing what you love. Thank you so much.
Thank you so much, Dean Fox.
Okay,
Thank you to
bye-bye.
our moderators as well. Did a great-
Yes, thank you.
And
Good
Alexis.
questions.
Yeah. Thanks, everybody.